Right, it looks like it's about 12 o'clock, so why don't we just give it about another minute, and then we will get going. Thanks. Okay, I think we can get going now. So if we can kind of bring ourselves together here, we'll jump right into today's presentation. So first, welcome to another presentation in our Lunch and Learn series. Today we're going to be going through the relationship between criminogenic needs and evidence-based practices. So I think this is going to be a pretty good conversation. I'm going to hopefully bring some things to light and bring some things to the forefront for the field to consider as we continue to deliver services across the state. And so if we can go to the next slide, we will first bring to the table here the Deputy Commissioner and Director of OPCA, Bob Macron, for some opening remarks. Bob?
Thanks, Dan. Dan, you got a great radio voice that should bring you big money someday. I just want to tell you that. We've seen that in training, and you're coming across very clearly this morning, so or this afternoon now. Thank you. I just want to welcome everyone. First, I want to say that I hope that you and your families and your staff are doing well at this difficult time. I want to encourage you to continue to take every precaution to guard your health and that of your families. And I also want to express our appreciation to all the service providers out there, DCJS funded and beyond, for the great work that you continue to do. And please express this to the members of your staff. Got a really exciting installment. I think this is the last one in a series. Learn at Lunch, Lunch and Learn. This one on criminogenic need and evidence-based practice. And I'll just say briefly, when it comes to criminogenic need and evidence-based practice, we know that unless we address the criminogenic need, the drivers of the criminal behavior, we're not going to be successful in helping an individual challenge their own thinking, change their thinking, and ultimately change their behavior. So the criminogenic needs, right, criminal attitudes, criminal thinking, criminal associates and peers, we're going to learn a lot more about those and how to successfully engage clients. This has been an excellent training series, and I want to thank the staff, the entire OPCA staff, both particularly, though, from the ATI unit and the VER unit, Vocation, Education, Employment, Reentry, and even our training folks on the line. So thank you all. Dan, thank you.
Great, thanks, Bob. So I should probably introduce myself. So I'm Dan Robertello. I work for OPCA. I'm a criminal community correction representative 2, and I work in the ATI unit. In addition to myself today, we're going to be joined by Michelle Clark, who's community corrections representative 3, and also the manager of the VER unit. So she'll be picking up the ball a little bit later in the presentation. But I'm going to be opening things up here. So if we can go to the next slide. And so take a look at kind of what we're looking at today, learning objectives. So we're going to very briefly touch on the 5 pillars of evidence-based practice, and we're going to really be focusing our discussion on the principles of effective intervention, particularly the risk-need responsivity model of programming. As Bob mentioned, we're going to be getting into the criminogenic needs, really trying to get very specific as to again, what are the predictors, what are the drivers that, cause individuals to have system involvement. And then we're going to conclude by making sure that everyone has a sense of how to kind of incorporate the programs that we have at our disposal into, changing those very factors. And then I think at the very end, we also have a great speaker from the field. Jeff Pryor is going to come to the table here and give us a sense of how he's managing things in his jurisdiction as well. So that is what we have today. So looking first, as we said, we're going to just kind of very briefly revisit the principles of effective intervention. We're going to land on that last one, number 5, the risk-need responsivity model. But to be really specific here, we are looking at sort of 5 factors when we are delivering programming, when we're delivering services that we really want to keep our eye on to make sure that we're doing so well, that we're doing so with fidelity. And it begins with taking a balanced approach to the work that we're doing. You know, I think gone are the days where we're focusing solely on managing risk. We want to reduce risk. And so the only way that we can do that is through prescribing appropriate services. So as Bob said, we want to get to those drivers and those predictors. And if all we're doing is sort of reacting and just sort of putting in different accountability measures in place all by themselves, we're not going to get very far. But if we're adding in that service element, we are going to see that that our approach becomes a lot more balanced and becomes a lot more specific for the individual we're working with. Second pillar we're looking at is procedural justice. So if you just go back, there you go. Procedural justice. So this is, when we say procedural justice, we're really talking about fairness and process, right? So making sure that the folks that we're working with have a sense of, you know, what we're doing, being transparent in our actions. Again, this is not something that shifts the sort of the power differential between yourself and a client that you're working with, but it really does inspire, you know, sort of a feeling of fairness that only strengthens engagement. And then where that takes us is that individuals that feel like they've been treated fairly by our system tend to be more accepting of the decisions that are made as part of their case. Number three, we have trauma-informed care. Just really, really thrilled that this is now part of kind of regular conversation that we have in this field. I think that we could probably be safe in saying that all criminal justice involved individuals have experienced some sense of trauma. I might go so far as to say that just having contact with the criminal justice system inspires trauma, whether that be at the point of arrest or the point of processing, the point of incarceration, or frankly, at the point of release, which can be a traumatic event in and of itself, which is something that we do see in our communities as well. The fourth pillar that we're looking at is equity, and that means that we're going to provide these same opportunities to every single person, regardless of any factor that they are presenting with, right? So we want to make sure that we are leveling the playing fields for all races, for all genders, and so forth, right? So it really is about leveling that playing field. And then finally, we're going to be talking about the risk-need responsivity model of service delivery. And so we can now go to the next slide. So it's really important, and I think this comes as no surprise to anybody that's on the call today, that in our field, we have not always been having the conversation in this way. We have not always been attentive to what actually works, what are the needs of the people that we're working with. So I think it's just really important to highlight that this shift in perspective is something that's come about really in about the last 20 years. So if you rewind the tape all the way back to the early 70s, you got the Comprehensive Drug Abuse Prevention and Control Act, which of 1971, that really contributed to an explosion in arrests, that it contributed to an explosion in our prison population, deepened the disparity between races in terms of the outcomes that our system produced. And that was, you know, really carried forward through the 80s when we saw just numerous arrests for possession of drugs, you know, commonly known as the war on drugs. And that even brings us right to the mid-90s when we see the Violent Crime Control and Law Enforcement Act, which did result in, again, an explosion of arrests and incarceration. And only really, again, in the last 20 years have we really started to shift the conversation into, you know, stepping away from the punitive heavy system responses and stepping away from packing the prisons and that sort of thing, and really now looking at the individuals that we're working with as individuals, right? And the most important piece there as we transition into the what works perspective is that reform is possible, change is possible. We're no longer accepting of the notion that people are just criminals and they can't change and that is just what it is. We are long past that. And so in order to really get to that core of the individual, we do have to adopt a model that is rooted in research, that has some scientific backing. We don't want to shoot from the hip. We don't want to run with our gut at every turn, right? So we want to be able to use what we know to be effective in working with the populations we work with. Next slide, please. So this is just a quick kind of graphic just for everyone to wrap their brains around. I think this is a really easy way to understand what we're talking about today, is to think about the risk-need responsivity principle. Hold that last one at the bottom, program integrity. We'll get to that a little later, but really focus on the top three. So when we're talking about a risk principle, we're talking about who is receiving services. When we're talking about the need principle, we're talking about what services are appropriate for that person. When we're talking about responsivity, we're talking about how to best deliver those services to the individual that we're working with. Next slide, please. And so let's look first at the risk principle. So as the last graphic, I think, really demonstrated really well, is that we're talking about who should receive the services that we are giving, right? And so I think that, sometimes, certainly as a former service provider, I think that it was very easy for me to focus a lot of energy on low-risk cases. So, folks that don't really rock the boat, they don't really have a whole ton of needs, pretty easy to talk to, that sort of a thing. But really what we want to do is to focus our most intensive services on the highest risk individuals. And the folks that fall into that low risk category, we do not want to give them that type of, that level of treatment, right? So this risk principle, once we're really identifying who we should be targeting, that is going to just create a domino effect where we are affecting case plans, or we are developing, reporting schedules, treatment schedules, and that sort of a thing. So the first thing we have to do in this whole big puzzle that we're looking at today is we have to decide who it is that should be given the most attention in terms of the services that we provide. Next slide, please. Now, when we look at the need principle, what we're talking about here is, what types of services should this person receive, right? So we know that there may be high risk, but how do we know for sure what the best method to make this happen? What is best for them? And so in order to really understand the need principle, we have to really understand risk factors and what risk factors are present in their lives that might push them in a certain direction in terms of the programming they receive. And so when we talk about risk factors, we're really looking at two types. So first, you see static risk factors. And so what we mean by this are the things that can't be changed in a person's life, right? So a static risk factor, or just a static factor in life, would be when you were born. You can't do a lot about that. You were born when you were born, and that's really just the end of the story. And so, we look at the same thing of, say, criminal history. We can really, really focus on that. And sometimes rap sheets can look really scary because there are so many offenses listed and so forth. But, does it really make a lot of sense to focus on something that we really can't change? Can we discuss it? Sure. Can we try to, develop some context around that history? Yes, of course we can. But can we change it? We cannot. And so we have to really be, judicious in which static risk factors we want to address and then how. So looking at the second set of risk factors, we would call dynamic. And so these are the things that we can change, that we do have influence over through the programming and services that we provide, right? So attitudes, beliefs, and values, although, of course, it might seem that those are unchangeable things, they are changeable. These are things that even if you have a history of, thinking a certain way, behaving a certain way, or holding these values or outlooks of the, on the world and so forth, there is room to change those perspectives, but it's only going to come if we're delivering the right types of programming at the right level. Next slide, please. The responsivity principle, I guess this is maybe kind of like a nerdy statement, but it's, I guess, kind of my favorite principle, because this is really where I think, a lot of your individual skills are going to come into play. As we know from our own experiences, whether it be through our education, whether it be through our professional experiences or whatever, is that we do not respond to things the same way. We do not learn the same way. We do not intake information the same way. We don't process it the same way. So responsivity is really trying to get at how do we deliver services to this unique individual. And so what would we be responsive to? We would be responsive to things like learning styles. That could even include things like learning disabilities. It would be really difficult to have to work with a person and, put them in programming that requires lots and lots of reading if their reading is only at, say, like a 3rd or 4th grade level. So, being responsive means really trying to understand exactly how to deliver those services when those types of things are present. Same thing with strengths and barriers. Another thing that we have to really consider is motivation, right? So, I can definitely speak for myself by saying that, I change when I'm motivated to change. Others might want to motivate me to change, but that's really not something that anyone has really full control over. So that's where we start to bring in different models like the stages of change to really understand, where is that person on that cycle? Are they in a pre-contemplation stage where they don't see, an issue in their lives? They don't see that there's any problem. Or maybe they're in the preparation stage, and so that might require that will require a whole different set of responses from you. You know, that might be, you know, looking up information. That might be doing some like some mock interviewing or whatever the circumstance, you know, calls for. But we need to be really kind of specific again to be really truly responsive to the individual that sits before us. You know, to put it, I guess simply, this is really meeting someone where they're at. So that will be the next slide, please. Principle of program integrity. So this is really how we know what we're doing is actually working. I mean, or not, right? So, you know, what we're talking about here are the systems, are the, you know, personal organization systems or, you know, agency-wide organization systems that help to make sure that the work that we're delivering is being delivered in an effective manner, right? And that can occur on the organization level, and that's something like having a quality assurance system or a department, right? It means keeping policies and procedures updated, contemporary for your staff and your circumstances and your locale. Really looking at the outcomes that your agency is producing and seeing, do those outcomes align with your organizational vision? Does it align with your sort of your organization's cultural kind of cultural goals, right? We can do the same thing at the employee level, which I think is really an effective thing for individuals to really think about. You know, developing a QA system that just works for you, making sure that, you know, your documentation is tight, and making sure you have a way to kind of check that periodically. I also really encourage is ongoing learning. OPCA puts out, in my opinion, some really excellent training opportunities. Many of them are low or no cost to learners. And I really think, especially now, as you know, we have a lot of folks working from home. You might have some downtime because of the way that, you know, openings are occurring throughout the state. Send your people to our virtual trainings. You know, because I think that only, you know, expanding that knowledge base only contributes to the overall integrity of the program. Next slide, please. And so, you know, we could sit here all day. And we could name all of the things that contribute to, you know, offense behavior. You know, and there's a lot of backing for a lot of those things that we might discuss. But for the purposes of today's conversation, we want to focus on what we call the central 8. And so, if we can move to the next slide, we can just look at that list there. Okay. So this is what we were talking about before, the central 8 criminogenic needs. And so they are as follows: history of antisocial behavior, antisocial personality pattern, antisocial cognitions, antisocial associates, family and or marital, school and or work, leisure and or recreation, and substance abuse. And so, you know, these 8 concepts, they did not, you know, kind of occur in a vacuum. We didn't pull them out of the air. These are, you know, the result of years and years and years of study and research that has sort of boiled all of it down to these 8 items that we believe, and it seems as though research kind of bears it out, that these are sort of our best predictors to determine a person's propensity to offend, we'll say. Next slide, please. So we thought it would be interesting, at least briefly, to kind of go through each of these 8, kind of give you a sense of what each of them means, and then try to offer, you know, a couple of different programming options that might work if you see this type of thing manifesting with the folks that you work with. So we start with the history of antisocial behavior. So this does not necessarily mean criminal behavior. This does not mean offense level behavior. You know, this is going to include, you know, anything from discipline and, of course, up to and including system involvement. But we have to remember, when we're talking about history, the history in and of itself is not changeable. So if a person sits before you and they are, you know, 35 years of age and they have this long history of these characteristics, we can't do anything with that history. We can acknowledge the history. We can review the history with them to make sure that what documentation we have actually reflects their lived experience, right? We do know that our system is imperfect in the documentation that sometimes gets passed around, and We do know that, labels stick over time as well, right? You could be a person that was, diagnosed with something in an emergency room, 20 years ago that doesn't fit with the person that sits before you today when they have the benefit of like a full psychiatric evaluation. So we can't do anything about the history itself, although we can definitely explore it for accuracy and maybe even explore it for personal impact. Next slide, please. An antisocial personality pattern is another of the central 8. And so what we see here, again, this is not about, we see folks running around and just, breaking into houses and acting, really dangerously. An antisocial personality pattern in this sense, we're talking about impulsivity. So really not thinking through decisions that might require and should require a bit more thought. So maybe an unwillingness to conform to the rules. Then that can be in a job setting, that can be in a home setting, that can be in a treatment setting, right? So we're not saying that these are criminal characteristics. We're saying that these are characteristics that seem to predict, in some cases, a person trending in that direction. But fear not, because this is a dynamic risk factor. Therefore, it is changeable. A personality pattern is something that you can work on. Take impulsivity, for example, that is something with the proper services delivered at in the right manner can be really, really impactful for a person that suffers from kind of impulsive thinking patterns. And so our team kind of went through the different interventions that our office or that our agency endorses and that we see used quite a lot in the field. And so we listed those there as interactive journaling, thinking for a change, and moral recognition therapy. Next slide, please. Antisocial cognition. So again, this is about the thought process that sustains the offense behavior. So it's kind of tied with the last slide, right? Because we can kind of see how a personality pattern and cognition might kind of work together a little bit to kind of create this perfect storm of for an individual. And so again, we're talking about the decisions that a person is making in order to that will be sustaining the offense behavior. This is a dynamic risk factor, therefore it's changeable. And then again, we offered just a few different programming options for you if you happen to see that manifesting in your client base. Next slide. And I think if the next slide is family or marital, I think that is you, Michelle. Thanks for your attention, folks.
Hello, everyone. Thank you, Dan. Yes, so moving right through the central 8, and I'm starting off with family and or marital. So as you can see on the slide, this is a criminogenic need characterized by what you see here: unsupportive, dysfunctional, poor, otherwise conflictual family relationships. And this is a dynamic risk factor, so it's something that we can target when case planning and addressing criminogenic issues that cause rise to cause issues with respect to recidivism. So the nature of a client's reactions to and the decisions around relationships, the way they communicate, the way they adapt and develop trust within families is something that can change. However, historical pieces of a family, issues that existed, experiences, are something we can't. The thing to focus on in this particular criminogenic need is using interactive journaling or some other type of program such as MRT, otherwise known as moral recognition therapy, or a program that's more geared toward youth, which is strengthening families. And these programs serve to help individuals learn how to change their behavior by changing the way that they think, by changing maladaptive thoughts and feelings around their family to more positive pro-social thoughts and feelings, which then will lead to hopefully better behavior, increased communication skills, and adaptability, but when it comes to working through challenges that exist within a family or a marriage. So moving on to the next slide, please. Okay, so school and or work. So what do we know about employment and achieving education and vocational goals when it comes to the people that we work with in the, the ATI, reentry, and probation world. What we know is that these things, achievement and education and vocational training and employment increase the chances that these individuals will remain crime-free. So programming for those who have moderate to high risk in terms of their employment history or lack of education, vocational skills, as well as moderate to high employment needs is really key to helping them become successful. School and or work as a criminogenic need is a dynamic risk factor. So of course it is changeable. We can make improvements there. And a suitable program intervention, of course, would be something like Ready, Set, Work, our 20-hour program developed in conjunction with DCJS and other partners to provide assistance to individuals, helping them to develop resumes, practice interviewing, learn effective communication skills, learn to address barriers that may impede their success in employment. So Ready, Set, Work, as well as another one that I can think of with respect to interactive journaling, there's an employment journal there, as well as perhaps responsible thinking that could also increase someone's ability to obtain and maintain work. Next slide, please. Okay, so leisure and or recreation. So the old adage, idle hands are the devil's playthings is true, and the more one is unoccupied, the more likely they are to slip back perhaps into old ways, perhaps even criminal thinking, and even get into trouble. So this is a dynamic risk factor, and it is changeable. So what we're trying to do is help individuals who may not know what it feels like to be in a positive, structured recreational program learn how to find them, and having us be able to make those connections and link people up to those types of programs. If you look at the last bullet here, it says recreation and a question mark. That pretty much notates endless possibilities here, because we could connect our participants with community-based organizations that can provide them with opportunities to engage within the community in a healthy way, by volunteering perhaps at a local food bank, participating in recreational sports leagues, maybe even kind of digging into whether or not someone had a great sports history in their past. Maybe they'd even want to help coach some individuals within their community to help them structure their time better, or referring someone perhaps to attend a self-help or support group within their community. These are all ways to help them positively structure their time. Interactive journaling actually has a journal specific to leisure and recreation that could also be used with participants. Next slide, please. Okay, so substance abuse, of course, is a dynamic risk factor. It is changeable, thankfully, characterized by use, abuse, and or dependence of alcohol and illicit substances. So what we do as practitioners and, probation officers, ATI staff, et cetera, we make referrals, of course, to appropriate service providers when the need exists. And we obviously have to maintain ongoing communication with people within our communities, treatment providers, et cetera, and bring them to the table as much as possible when case planning. We also do have, MRT, moral recognition therapy, does have a substance abuse curriculum, and interactive journaling does have a substance use journal. Now, these things aren't meant to replace treatment when an individual has a significant substance abuse problem, but they are in place. They could be put into place rather to help support change and sobriety. Next slide, please. Okay, so why are we using CBIs with justice-involved clients? Well, there are many reasons why we do this. I want to start by saying that there is considerable evidence that programs based on this approach, CBIs work. There's a organization called Pew Research. You can Google this foundation, and I'd encourage you to do your own review of their literature on criminal justice programs that work to reduce recidivism and the overall cost benefits of using these evidence-based programs in your work. What we know about CBIs is that there's evidence, as Dan mentioned at the very beginning of this PowerPoint, that exists across target population settings and researchers, as well as other countries, in support of the use of cognitive behavioral interventions. Interventions based on the risk, need, responsivity principles have produced the most consistently positive results in terms of education, vocation achievement, treatment for substance abuse disorders and other health problems, and strategies to change thinking and behavior away from crime. I'd like to just point out at the bottom of this slide that there's a link to the crimesolutions.gov website. I'd like to encourage you to review the literature on that website as well to learn more about the results of studies surrounding evidence-based programming with justice-involved individuals. Next slide, please. So, continuing to review these advantages of CBIs, based on research, cognitive behavioral programs have shown to reduce recidivism, like we said, addressing criminal behavior, antisocial attitudes, consequential thinking, impulsivity. Supervision alone without treatment does not improve these outcomes, and subsequently, when we see these things happening where there's no treatment or no interventions put into place, we see increased technical violations and maybe acting out behavior. So if you look at bullet 3 also, CBIs focus on the here and now and teaching clients how to manage past events, for example, trauma and the impact that's had on their lives, and to avoid future problems by learning adaptive coping strategies. So what we know about, ourselves is that our feelings impact our thinking, and our thinking impacts our behavior. So CBIs are intended to help our participants move from those maladaptive thoughts and feelings I talked about earlier to healthy pro-social thoughts and feelings. And research tells us that by doing this, this can have a positive impact on behavior. So for number 4 here, my mind immediately goes to the tools that we have right at our fingertips, such as the decisional balance and pros-cons lists. And these types of tools are used in most all of the CBIs that we train on and support, such as interactive journaling, T4C, and MRT. Next slide, please. And last of this series of slides about why we're using CBIs with justice-involved clients is we can use cognitive restructuring, of course, and teaching new cognitive skills to help our participants make better choices. We deal with individuals at times who have extreme emotions, and helping them to manage those, regulate their emotions, and make better choices is key, and that is what CBIs strives to do. And according to Pew, the research center that I talked about earlier, people who reoffend, after leaving prison do so usually within a year of release. So directing community supervision resources and support services, I guess, around the first days, weeks, months post-incarceration or at the start of a sentence of probation or working with your programs is a pretty surefire, cost-effective approach to improving outcomes for public safety and people on supervision. So that speaks to the number 6. I actually see that there's 6 on here twice, and I apologize. But basically, there are many options and choices that you can use. And getting back to the slide prior, I just want to point out that crimesolutions.gov website will give you a pretty significant list, menu, if you will, of promising model programs, effective programs to work with juvenile justice and adults involved in the criminal justice world. Next slide, please. Again, just kind of re-emphasizing the need for us to show you that there are websites that you can go to. And I just want to say that, I was a probation officer for many years before coming to OPCA. I often found myself researching evidence-based programs based on the needs of the individuals I worked with. So for example, if I noticed that there were many youth on my caseload who struggled with family or school problems, I would then go to my director and ask to be allowed to be trained in something such as family functional therapy, which is certainly an effective model program, blueprint program, or a program like Strengthening Families. And one of the things that we say to ourselves sometimes, and even to each other, our colleagues, is, sometimes the cost of these trainings is quite expensive, but what you have to look at also is that some of them are not. And for example, Strengthening Families out of Iowa State, it costs only around $5,000 to train about 30 professionals. So my point is if you don't ask, your director of your program or your agency, the answer is always going to be no. And the best way to get your respective agencies and departments to invest in these programs that work is by going on these websites, attending our trainings, learning what programs produce the most positive outcomes for the population you serve, and then taking it from there. And next slide, please. Without further ado, I would like to introduce our guest speaker for today. His name is Jeff Pryor. He's the Reentry Director of Broome County. as he has many years of experience providing service coordination and case planning with justice-involved individuals in the community as well as the jail-based program in Broome County. Thank you for being with us today, Jeff.
Thank you very much, Michelle. I appreciate it, and thank you for the opportunity to share our experience here in Broome. I want to start out with what we do. There's really 3 steps that we work toward before we meet our clients, our participants, and the first is the case conference committee. That's where the work really starts. The second portion is going to be at the intake, and then finally, when we're actually doing the work on the ground with our participants in front of us. But going back to the case conference committee, that's where we really sit down with all of the professionals in the community that this person is going to possibly interface with, from substance abuse to mental health. Most importantly, it's driven by the parole officer and the COMPASS risk assessment that was done prior to the individual's release from prison. And we look at the person as a whole. We see what their biggest needs are. We look at the static factors, things that we can and cannot change. We look at parole mandates. What have they been identified with that is mandatory that they complete because of their crime, and what can we then offer additionally that the person might want to address. We create a list of about 3 to 4 things for each person coming out, and then at the intake, when we meet the individual for the first time, we start off by sharing who we are and why we're here, and that the person's been selected for the program, that you have to qualify. Not everybody, even if they want reentry, always is able to get in, because there are so many folks wanting our services, and that they were able to qualify for this, and then we ask them their opinions about what's important to you. We let them drive the interview. We see what's important. We come up with goals that parole wants them to complete, at which there's not a lot of leeway in. And then we ask them, based on our list of 3 or 4 identified areas from the COMPASS, what's important for them to work on? What are their next steps, or what can we help them with in the next 30, 60, 90 days that they're going to be in the program? And then we help put in place the steps that it's going to take to get them to their next level. Once we have come up with, and they usually, most of the folks in our program are mandated to take a domestic violence class or an anger management class. And so one of the journals that we pretty much give everyone is responsible thinking, because it's our thought process many times, like you were saying, your feelings drive our thoughts, which drives our behaviors. So we use the responsible thinking as a cornerstone book to get us started, along with getting started, and then we let them pick 1 or 2 more of their own. It's important to work at their pace, and it's also important to have mutual goals. If we tell them what they're going to do, as we know, when you're told what to do, you don't want to do it, or you do just the opposite. So we want to get them to buy in, and we make the program about them. Pre-pandemic, we did everything in person, and I love the in-person, the one-on-one, the small groups, the large groups. And because they're working at their own pace, they're actually able to help each other out. But as soon as coronavirus came about, we had to pivot to phone call or Zoom meetings because of the ability to, the safety of the Zoom. We weren't sure about the security or hacking or fraud or any of that, because it was so new to us. So we only had our clients call in, and it was all by telephone. 2 months into it, we realized that we weren't able to build a very therapeutic relationship. The trust wasn't being built, and they started missing classes because it was just another class to them. And so, thank goodness, in August and late mid-September, we were able to pivot back to 1 day a week in-person classes. And so now we've learned from that, and the needs responsivity is what we use as a, I don't want to say a carrot, but as a positive aspect. What we're doing is do the first 4 or 5 classes in person. And then if you get a job, because we're going to work with you on employment, we can pivot your classes until they're completed by moving you back to the call-in or moving you to the phone Zoom meeting. And we found that there's a lot more buy-in when they realize if they achieve a small benchmark of 3, 4, or 5 classes, that they can then stay home and do the rest of their programming over the phone, we found that our attendance has significantly increased. When we're looking at antisocial, or the central 8, as you pointed out, some of the things we look at when we think of antisocial behavior is social isolation. You know, do they isolate themselves? Is that antisocial? I'd rather be by myself than anybody else because I don't have to get in trouble that way. Some of the journals that we would target in this area would be like peer relationships or even self-control. Antisocial personality patterns, we look at impulsivity, we look at sometimes anger, because there's a lot of anger in a lot of our folks built up, against the distrust in the system that they're in, a lot of the oppression and systemic racism that's going on, and then in our own community. So we look at self-control as a journal that we might be able to offer them there. Again, there's a lot of overlap amongst the central 8 in the journals that we can use. Responsible thinking might be another one. Antisocial cognitions, we look at social isolation in this one again also because of their attitude. Social values is a really important journal here, and we found that a lot of our folks, when offered, they do take the self-control and the social values. Those seem to be very important, or popular, I guess you could say. Antisocial associates, peer relationships and family ties. We want to know, is your family or the people you hang around, are they birth, are they blood, or are they chosen? Or is it because they're the only ones in the area and those are the ones that more or less adopted you into their, maybe it was a gang, or on your street you had to be a part of this group. So we can look at family values because some of our participants view the people in the groups that they're in as family. And then peer relationships is another really strong journal we use when we're looking at antisocial associates in the family and or marital. School and work, of course, goes without saying. Employment is paramount for all of our individuals. We offer Ready, Set, Work to every person coming through our program, and it's almost the cornerstone of what we do. Our employment, the biggest selling point for us to share with them is, how do you talk about your criminal background, or what we would call a conviction speech? And we actually have them, by the 4th class, start to write their conviction speech. What did they do? How did they get to where they are? What are they learning? How are they going to move forward? And then we take that and we then tailor it. And then we role play with them. We hand it back. We let them speak it in their own words so it's real to them and they can own it. But just like I'm speaking with you today, we want them to practice it 2, 3, 4, 5 times with us. We pretend that we're them and they're the employer, and then they're themselves and we're the employer. But we want you to be able to speak about your criminal background in a positive way, minimizing some of the negativity, and then not revisiting it during that interview. Some of the ways that we use to keep our folks engaged is we offer stipends. When you graduate a Thinking for Change class and you've completed 2 journals, one might be pro-mandated, one might be self-selected, you can earn $20, $25 Walmart gift card. If you continue, we have a lot of folks that will stay in. We use one journal that's quite a bit more in depth that we offer, and it's about 98 pages in length. It usually takes our folks a couple of weeks, and we give them a lot of life work. Take it home with you, work on these 5 or 6 pages, bring it back to class. We sit down, we go over with what they did, and then we teach the next lesson. Letting them drive their own recovery process has helped us to be more successful because they are building the ability to trust us. And what we say is how we follow through. We don't say one thing to one person and another to another person, and then they see discrepancies in the way that we speak. But we let them know that this is what we've put out to achieve as a goal. And when you're not making the goal, we sit down and maybe we re-strategize. Okay, is this not the right journal for you? We can revisit the Compass risk assessment and maybe pick something else more appropriate at the time. We've never had anyone come back and say, gosh, what a waste of my time. We usually hear, I had no idea, or this really helped me slow down and think, especially with like the self-control and anger. This really helps me think differently about why I was reacting the way I was. And finally, if you take our Ready, Set, Work class, we offer you, we usually run it 5 nights a week for 2 weeks consecutive, 2-hour classes, and you get a weekly bus pass. For the first week, you get a weekly bus pass. For the second week, when you obtain employment, you receive a 31-day bus pass, and then you can continue to get a 31-day bus pass for 3 months as long as you maintain employment. It's a $350 value for that individual to stay engaged. And then the Walmart gift cards, of course, help them buy the things that we don't offer. We do hygiene, but we don't do a lot of paper products and stuff. So it really helps them, and it supplements what they're getting from DSS. So that's what I brought to the table today. Just a lot of motivational interviewing, a lot of restructuring, so it's a positive self-talk. You're not a drunk or an alcoholic. You're someone that drinks. You might have a drinking concern. You're not a drug addict. You're somebody who's addicted to drugs. And when they speak those negative words about themselves, we try to restructure it so it's positive and well received. Thank you.
Thank you, Jeff. So it was great to hear from someone who works directly with participants within our reentry population as well as the jail-based programs. And I think it's important to recognize that, you know, you went through each step and making sure that the individual has a voice, that they are an integral part of developing their own plan, that the individual understands that there's been an assessment and that there have been needs identified, and then giving that person an opportunity to select which interventions they use is really important. And the incentives that you spoke about are important as well. I'd just like to say that we have some time before the close of our webinar at 1. If anyone would like to ask any questions in the chat, you are able to do so. And thank you, Jeff, so much for your insights and the look at how you do the work in Broome County. It was very helpful. So I'll leave you all to put any questions in the chat if you'd like to, and we'll just give you a few minutes there, and we'll check back in a minute. Thank you. So I do see a question here, and I think it's probably meant for Jeff. It's how do you go about your procuring in your county for the money for the gift cards that you give out as incentives?
We budget that as part of our client aid. So when I write the grant each year and I work with my finance team, we look at how much money we have for which areas. It's important. We budget probably $15,000 just in bus passes. Because we buy a large quantity at a time, we're able to get our $75 a month bus passes for $44 each, which is a significant savings because we'll spend, you know, $4,000 or $5,000 in one shot. So they give us a great price on that. But it's all budgeted in when the grant's written the year prior.
Thank you, Jeff. We're still monitoring the chat for a few more minutes to see if there are any questions coming through. I'm not seeing any at this time. We will be posting this webinar, just like all the rest of the Lunch and Learn presentations, on the DCJS website. That has not occurred yet, but it will occur soon. And once we do, we will let you all know. There have been some requests in the chat for individuals to receive a copy of the PowerPoint, and we can certainly work with you on that after the presentation. But as I said, this will be available to everyone on the DCJS website within the near future. So to that, oh, I'm sorry, we have one more comment that needs to come through from Jeff Pryor. Sure, Jeff.
Thanks, Michelle. The Change Company's journals are amazing. And in the beginning, I was after I went through the training, I was very insecure in implementing them. I had a lot of questions. This didn't feel like it was going very smoothly, or that was going too good. I would call them and have a conversation with them on the phone, and they guided and directed me quite a bit when we were doing closed-end groups versus open groups. So I would say if you have a lot of questions or concerns or uncertainty about the journal or questions within the journal, they're an amazing resource, and they're always willing. And they call us about once every 6 weeks just to touch base to see how we're doing. So I really appreciate that level of service. Thank you.
Thank you, Jeff. Yes, the change companies are helpful as well with respect to answering any questions and helping individuals who've been trained to, you know, provide group or individual facilitation. So they're readily available. You can look them up on their website and get help from them at any time. We also will be hosting some trainings in interactive journaling coming up, I believe, this winter, and be on the lookout for some training announcements for that. So if there's no other questions, and I'm not seeing any pop in right now, if there are any I missed, we will certainly get back to you individually. Thank you again for joining us today. Thank you, DC and Director Macarone, for your welcoming remarks. And thank you, Dan Robertello, for partnering with me on this event. And Jeff Pryor, thank you for coming and sharing with us your experiences from Broome County. Have a good day, everyone. Thank you.